Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It is 9 a.m. on Friday, and you know what that means. It means Deb Burton from RI Elder Info is bringing you Friday Friends and a guest that you or someone you know needs to know about. So it's really important that you hit the like button and the share button because we are talking about a resource today that is extraordinarily needed across Rhode Island. Well, actually across the country. So please help us get the word out by hitting the like and the share and talking to your friends about it, because this today is going to be something that actually could be a lifesaver. As you know, we are a 501c3 nonprofit, and we cannot do the work that we do in bringing you this information without the support of our sponsors and our donors. So big thank you to Aetna and to United Health, Oak Street Health, 321 Media, making this look good behind the scenes, and England Studio. They are our web design team at rielderinfo.com. And you'll be able to find this information on rielderinfo.com. All the links are on our website for this, because this is a super important hot topic. And for this month, we have Ocean State Center for Independent Living as one of our special sponsors, and they have a few words for you about a new program.
Did you know that smart home technology may help you live more independently? People with disabilities may apply for smart home technology through Ocean State Center for Independent Living's Smart Home Technology Program. Devices include smart locks, video doorbells, alerting systems, smart bulbs, and smart hubs, and 2 months of connectivity. You must be a Rhode Island resident with a disability and fall within this program's financial guidelines. For more information, call us at 401-738-1013. or contact us by email at info@osl.org.
They have some great programs over there, so I encourage you to reach out. So I would like to welcome up Dr. Marty Nager from the Dental Lifeline. Hi, Marty.
Hello. Happy Friday.
Happy Friday. So please share with everyone, what is the Dental Lifeline?
So we are an organization called Dental Lifeline Network. And we are in all 50 states in the United States, and we started in 1989. In Rhode Island, I happen to be the president of our Rhode Island chapter. What we do is we treat the elderly, the disabled, medically fragile, and veterans for completely free dental treatment, no cost whatsoever, in private dental offices. No clinic. So the way this works is we actually have a volunteer network of private dental offices and dental labs in Rhode Island. Right now that number changes all the time with new people coming in and people retiring, but we have 210 of the 450 dentists that practice in Rhode Island in our network. So if you are elderly and don't have the means to pay for dental issues or dental or oral care, if you are medically fragile, disabled, or a veteran that doesn't have the appropriate level to be able to receive certain types of dental treatment, you simply enough go to our website, which is dentallifeline.org. And from that website, you can click on the state of Rhode Island and come up with our Rhode Island state. From that website, you can get all the information you need about our program. You can also download an application to apply for the program. You could print out the application and apply. You could donate money if you thought that was something that you were interested in helping other people. So once you are accepted to the program, it is not for emergency care. There's actually a waiting list. You would be assigned to a dentist, and basically you would go to this dentist, and the dentist would do whatever dental work they thought was necessary in order to bring your mouth back into good condition. No insurance issues, no pre-estimates. There's nobody to ask about anything. You would just go in and be treated like a regular dental patient. No one would know the difference. The only difference is that when you leave the office, to make your next appointment. You don't pay anything, and the office keeps track of the amount of services that are voluntarily donated. So, for example, you might need a full mouth set of x-rays, you might need some gum treatment, you might need some extractions, a partial denture, a crown to fix a broken tooth. We actually do dental implants for patients as well. And so there's no limit to what the dental treatment is that the dentist can do for you. And so far, since our inception in 1989, we have treated 3,200 Rhode Islanders, and we just tipped over $8 million just in Rhode Island of completely free dental treatment, again, for elders and the disabled, medically fragile, and for volunteers. We get no government funding whatsoever, unfortunately, so we don't actually have a huge budget, so we don't do a lot of advertising. We do have a Facebook page, but other than that, word of mouth. Again, we've been obviously treating people for quite some time, and the way the program works is that you would just apply, you would go in, you would get the treatment done as long as that would take, and then when you're done, you're sort of dismissed from the program. You may end up with $3,000, $4,000, $6,000, $8,000 worth of free treatment, which is fine. And then when you're done, we try to get you to either a clinic or the dental hygiene school at CCRI in Lincoln, where you can then continue to get cleanings or deep cleanings or x-rays for free to be able to maintain the results of that treatment. So we are a terrific program. I would also be telling you that I'm super proud. We are in all 50 states. The national average of dentists that volunteer per state is 18%, and we are at 51% in Rhode Island. We're the highest in the country. We've got more than half the dentists in our state who lovingly volunteer for this program. It's a great program, and the dentist feels great about being able to donate what they can do. The office feels great about being able to help someone, and most importantly, the families and patients that receive this needed care, who just don't have the means to pay for it otherwise, certainly are grateful. And the program's been running for a long time.
Wow, that was a lot of information. And
Oh,
so,
sorry.
no, this is wonderful, because I think a lot of times when people hear that it doesn't cost anything, they think that it's like the bare minimum service provided. And it sounds like you can really help people with issues they have in their mouth.
So an elderly person who wears dentures, let's say that the lower denture just doesn't fit well. All right, well, okay, so that means that they don't wear it, or it's uncomfortable, or they can't eat. Obviously, that's an issue for anyone, especially an elderly person. So, and if that person who has a lower denture that just doesn't fit well has no means of getting to another dentist and either getting a new one or trying to get it fixed, they would apply to the program. They would probably come to see me or another periodontist or oral surgeon. We would put 2 dental implant little screws that go in the bone. That would probably cost around $5,000 if you were a paying patient to get those 2 implants in. So you would get the 2 implants done completely free. Then you would go from the specialist office to the regular dental office that you would be assigned to, and they would retrofit your denture and snap them into the implants so that you go from an ill-fitting lower denture to literally having to snap it out and snap it back in again. And that's life-changing. And that's $5,000 or $6,000 worth of treatment, happily done. And that's what we do.
That's amazing, because I think sometimes we take for granted the importance of our oral health, in that, yeah, if you have a toothache, you're not eating well. Or if the dentures broke or they don't fit and you're not eating well, that affects your overall body condition, the strength of your muscles. You wouldn't think of your teeth being related to falling, but if you're not getting the proper nutrition, your muscles get weaker and it increases your risk for falling. So what you're describing is huge, huge.
The mouth has always been part of the body. It happens to be, it doesn't happen to be your feet or your arms or your heart or your liver or your kidneys, but your mouth is a part of your body. And it is completely well known and documented that dental disease or oral health disease, gum disease, almost every adult has some type of gum disease. And especially if you don't get your teeth cleaned every 6 months, chances are most of the people who are listening to this podcast or watching this, you probably have some gum disease. Well, that gum disease doesn't hurt. High blood pressure doesn't hurt. High cholesterol doesn't hurt. So gum disease doesn't hurt. And however, eating and causing a bacteremia, or brushing your teeth and causing some blood to go through your whole body because it's all connected, is clearly associated with other health issues, such as very difficult management of diabetics. Disease doesn't cause diabetes, nor does diabetes cause gum disease. However, there are many people who are having difficulty keeping their sugar content at a reasonable level, only to find out, well, they have untreated gum disease, and that really is the problem. Or again, we found people that have untreated gum disease that didn't know they even had diabetes, but that was one of the ways we were able to diagnose it. Wow. So diabetes, high blood pressure, premature heart attacks, premature strokes, low-term pre-birth weight babies in women, pancreatic cancer in men. So please, out there, don't forget that your mouth is just as much a part of your body as anything else. And just because something doesn't hurt doesn't mean that you don't have a problem or an issue.
And that's super important. And you mentioned the CCRI Dental Clinic. And for those folks who are watching, if you want to learn more about the resources available at the CCRI Dental Clinic, after you're done watching us now, go back in the videos on RI Elder Info to our last virtual senior resource fair. One of our guests was from CCRI, and she does a great job explaining it. I can tell you, I myself have used the CCRI Dental Clinic because I want to support the students and their education in learning how to care for our mouths. And I was just there earlier this week and can confirm that the CCRI Dental Clinic in Lincoln is accessible for those individuals in a wheelchair. We are working on, the doctor and I were just speaking about getting a list of accessible providers for individuals with mobility impairments. We're working on it. Stay tuned on that one.
Yep. But sometimes people hear the word clinic and they, clinic is kind of a harsh word. It shouldn't be, but for some people it is. I would tell you that the CCRI clinic has the utmost latest equipment. It is clean. It is beautiful. The students are there learning how to do cleanings. They are under the guise of their professors who are standing right behind them. And the cleaning, it might take a couple of hours instead of maybe 1 hour, but it is a fantastic clinic, and it's a great place to go. And all the people who work there and teach there, they are just great, and it's a great place to be. By the way, you can go there even just to get some x-rays and your teeth cleaned, having nothing to do with the Dental Lifeline Network program. We're independent, but we just wanted to make people aware of the fact that CCRI was there, especially for after you've gotten all this nice dental work done on your mouth and it's all beautiful and clean and happy.
Yeah, it's a great program over there. So who is eligible for the Dental Lifeline? You had mentioned that it's not related to insurance. So I know some Medicare plans don't really cover any kind of oral hygiene. So how does that work? Are there income guidelines or financial guidelines?
Yes, I would just encourage people to apply. The guidelines are not rigid guidelines. I mean, we're all about people. So, I mean, if we can help, that we want to help. And so if somebody is over 65 or disabled at any age, or a veteran that perhaps were able to get teeth extracted at the VA hospital but didn't have the level to be able to have some dentures made, or going through some medical treatments, there was a patient who needed to have a kidney replaced and couldn't get on the kidney transplant list because the doctor looked in his mouth and his mouth was not in good condition, and the patient said, I have no dental insurance. There's nowhere for me to go to have all this work done so I can get on the kidney list. That's a medically fragile person. So they applied to our program. We got them to an oral surgeon who took all their teeth out, got them to a dentist who made them dentures, all for free. The patient got on the kidney list and ended up getting his kidney. So those are the kind of things that we try to help. So basically over 65 and financially don't have the means to be able to pay for dental treatment. So if you have Delta Dental, then you won't qualify for the program. If you have some other kind of medical benefits, dental benefits, you probably won't be accepted to the program. But you could certainly, I would say, you could apply anyway. And if we can help you, our goal is not to kick people out of the program. Our goal is to be able to accept as many people as we can reasonably do that. Now, again, there may be 50 people on the waiting list right now. So again, it's not an emergent program, but they will all get through. And like I said, we've done 3,200 people. We do this, 52 weeks a year. So there are other programs where, you might be able to, the Mission of Mercy is a fantastic program. And they do free treatments with, one thing at a time on a Saturday and a Sunday once a year. And, they treat, hundreds of people for 2 days. And then you have to wait again for the next year to come around. We're there 24/7. And if you're over 65 and don't have the means to pay for dental treatment, you can fill out an application and you've obviously got nothing to lose. And if there's any way we can accept you to the program, we'll get you moving.
Is there any limit to, say, for example, you can only use the Dental Lifeline once or once per year? Are there any restrictions on that?
Typically, it's once. Yeah.
Okay.
I wouldn't say that in situations haven't come up where something didn't seem reasonable and we were able to sort of help somebody out. I mean, again, we're here to try to help people, but basically it's once and done. And I think the average treatment per patient is around $5,000 or $6,000. Average. Wow. That's average.
That's amazing. And you had said it's in all 50 states. So if somebody's watching this in, I don't know, Florida, is there a program everywhere?
Our program is called Dental Lifeline Network, and we are in all 50 states. We are just celebrating $500 million of totally free treatment throughout the whole country since our inception in 1989 or maybe even 87. That's $500 million of completely free dental treatment for the elderly, the disabled, medically fragile, and veterans since our inception. That's big. That's big.
That is amazing. And are services available in other languages? So if someone, say, only speaks Spanish, can they receive help too?
We would certainly try to do that. I mean, there are certainly people that are Hispanic or speak Spanish enough to be able to help somebody. So that the language barrier shouldn't be an issue whatsoever. I don't even care what language it is. I mean, if it's Mandarin or if it's Korean or whatever else, we would certainly do the best we can do to get somebody help.
That is amazing. Now, if people are watching, are you a nonprofit? Like, how could they support the work they're doing? Do you need donations? Do you need people to talk to their own dentist to say, hey, like, become a part of this? Or what would be helpful?
We are a bona fide 501c3 and always have been. And again, unfortunately, we just don't get any funds from the government whatsoever. As it turns out, our biggest financial donors are the same dentists that volunteer for our program. And we've had a wonderful, fantastic relationship with Delta Dental of Rhode Island for the past 30 years. They were with us on day one, and they graciously match dollar for dollar all of the donations that are made by members of the Rhode Island Dental Association, which is all of us. And so to this date, we just surpassed $250 million. $250,000 of donations from Delta Dental of Rhode Island to keep our program going. That $250,000 is just, it's a lifeblood to us. So if somebody would like to donate, around Thanksgiving time, we usually sort of send something out on Facebook or whatever. Thanksgiving is a time where people get together with their families and they eat and they go around the table and say what they're thankful for. And that's a time where we really do well with donations. I mean, people who are lucky enough to be able to sit at a table and chew their food and be comfortable and not have gum disease or other diseases, and find out and recognize that there are people who aren't as fortunate. A donation of $10, $25, $100 goes a huge way. And again, all they need to go is to the dentallifeline.org website, and they can just donate securely right on the website. And you will receive a thank you note personally. And obviously it's deductible. And that's how we're still hanging in there.
I'm so glad that you were able to take the time to come on today, because
I appreciate it. Thank you.
Like, it's literally life and death. Like, you're making a huge, huge difference. So thank you so much for coming on.
Anyone that's listening, if you have dental issues, I mean, again, unfortunately, it's not for an emergency, but just go to dentallifeline.org. You're welcome to donate. If you happen to be a dentist listening to this and you'd like to volunteer, you can do that. Veterans, but just apply, and we will be happy to try to do for you whatever we can reasonably do. That's what we're here for. Nobody else can do this. Nurses can't do dental treatment. Physicians can't do dental treatment. Lawyers, accountants, the only people who can treat oral health and treat people's dental needs are dentists. So we've got a great group of dentists in Rhode Island specifically. Like I said, 51% of us all do volunteer work in a number of different ways, but certainly part of our program as well.
Go Rhody.
Thank you.
Thank you. Folks, we are keeping our teeth as we get older, and many are really having a hard time finding resources to take care of the teeth that we're keeping. And so it's really important that you share this, share it with your friends, share it with your family, share it in any of the community groups that you are in on social media, because this can literally be a life or death situation for someone. So please share this information out there. Help is available. And I don't know about you, but having a spare $5 or $6 grand available to take care of your mouth is not something that everybody has access to. And yet it can make a big difference in their overall health. So please share this video, get the word out. It's super important. I look forward to seeing you all again next week. In the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.